Welcome to the Diabetic Mogul Podcast. In this podcast, we offer standard and recommended practice of not only managing your diabetes well, but how you can get involved, get engaged, and come up together in advocating for proper access to healthcare. Join us in this journey as we host various guests, caregivers, healthcare providers, people with diabetes lived experiences from around the world, and learn from their shared experiences and expert opinions. I'm your host, Tino Tendenzikit, a patient advocate, volunteer, trust master, ambassador, financial intelligence expert with the vision of empowering, encouraging, inspiring the community in the best way I know how, by the sound of my voice. To find out more about our previous episodes, tune to the Diabetic Mogul on YouTube, and please do subscribe and share with your network. On this episode, we are having an extremely special guest, a pediatrician, endocrinologist, and a passionate person in serving communities and teaching, who also loves to see a better world for our children. Greetings to you, Doc. Please, may you introduce yourself to the audience?
Hi, Tino. I'm very happy to be here. My name is Dr. Prisca Matyanga-Mureriwa. I am a pediatrician. I'm also an endocrinologist. I work at the government hospital at Salim Mugabe Children's Hospital. I also work in the private sector, and I'm very happy to be here.
Wonderful. Thank you so much. I mean, as a person with so much experience, pediatrician, the care of the children, I know that we're going to have lots of information here, and so many people are going to love this, especially the parents who are the caregivers that might not have enough information. So please, maybe we could firstly maybe jump to our first question to say, I mean, considering the fact that we often share our experiences as people living with diabetes, and we often share our experiences. So in my conclusion, like, diabetes is unique. So I don't know if you could maybe share with us how diabetes in children is different from diabetes in adults.
Thanks, Tino. So what we have seen is that children have a different type of diabetes when you're comparing them with adults. So I'm going to give you a little bit of some of those differences that we look at when we're looking after children. So the first thing would be that children tend to get type 1 diabetes, whereas adults would get type 2 diabetes. So what do we mean by type 1? What we are saying is diabetes mellitus is a condition that leads to chronic high sugar levels, so chronic hyperglycemia. So that's the end result. But for children, it's really because they are lacking a certain hormone, a certain substance in the body called insulin. So they don't have enough insulin to be able to regulate that glucose gets into our cells. When we eat, we break down our food, it becomes glucose. That glucose needs to enter the cells for it to work. So the thing that makes the glucose enter the cells is called insulin. And children cannot make enough insulin because there's a certain part of the body, the organ called the pancreas, that is not working very well. In adults, it's usually a different type of disease. They may have insulin, but their insulin is not working very well. And that's what we really talk about, insulin resistance. That's a type 2. So for children, we've said they're going to get type 1 mainly, and then adults are going to get type 2. Although we know that the global incidence of type 2 is actually increasing in the adolescents, mainly because of lack of exercise, poor food choices, and being overweight. We are now starting to see a bit more of the type 2 also in our adolescents. But mainly the disease that we would be talking about for children would be the type 1 diabetes mellitus. And then we come to the reasons why they get type 1. So for children, it's mainly a combination of factors. There are genetic factors, there are environmental factors, viruses that can actually trigger that damage to that pancreas that we're talking about. And then the genetics, there's a predisposition for you to get it because maybe there's a family history of diabetes in your family. So we get a combination of things that are causing type 1 diabetes. And then for the adults, our type 2 has got the larger factor is the lifestyle factors, how you're eating, how you're exercising, and all that. Genetics still plays a role, but not as much as in children, where we get really a strong family history of diabetes there. And then we come to probably the presentation of diabetes in children and adults. We have classic symptoms that happen across the board. We've got patients coming in with increased thirst. We call it polydipsia. They are urinating a lot. They are very hungry, but they are not gaining weight. These are classic symptoms for whether you're an adult or a child. But with children, we tend to see them presenting with a serious complication called diabetes ketoacidosis, where they are very sick, they are very dehydrated, they really need rehydration, they really need their insulin. And adults tend not to present like that. They may present with something else, a different type of coma, but usually they present with these symptoms. But in children, we get quite serious complication called diabetes ketoacidosis. That's another difference. And then we come to looking looking at the effect of diabetes on the body. For children, like we've said, they get type 1. Mainly, they have got late complications. But in adults, they get very early complications. When they present, they're diagnosed with diabetes. In adults, you'll probably find they already have problems with their eyes, with their kidneys, with their heart. But with children, the good thing is they usually at presentation, they don't have these complications. We need to monitor them so that we can actually prevent these complications. And that's a good thing for children, that if you do very well, you're going to then prevent most of these complications. And these complications tend to occur maybe 5 years after your diagnosis of diabetes. So there's a lot that we can do in terms of optimizing, making sure that your glucose control is perfect. That's another difference in children and adults. And maybe something else would be that children tend to have sort of associations with other diseases that we call autoimmune diseases, because what we are saying is the pancreas is damaged. Maybe it's not just the pancreas that's damaged. Maybe the thyroid is also damaged. Maybe there's another organ called the adrenal that's damaged. So we tend to then look for other autoimmune conditions when we are looking after children, which is different when we are talking about type 2 diabetes mellitus. So in a nutshell, there are differences in terms of the type of diabetes. There are differences in terms of what causes the diabetes in children. There are differences in terms of the management of diabetes, insulin versus oral drugs, for example. There are differences in terms of complications of diabetes in children and adults. And then, as we said, those associations that are different between children and adults. I hope I've tried to sort of separate type 1 and type 2 diabetes.
Oh, thank you so much, Doc, for zeroing in with all these types. Then people just think that if you're a child, then it's type 1. Now that you've brought up the case to say even type 2 can actually be seen in adolescents, and which is a great thing. So now people should be alarmed to say, okay, fine. It would depend on when diabetes has presented itself, and even to the adults that if it presents late, and then it might come with so many complications. So thank you so much, even for sharing on the symptoms. Yeah. You have done justice, and maybe we might have less questions because you're already touching on all those in a broader perspective. So thank you so much for that. Allow me then to move on to the second question. I could have given you a follow-up question, but then we might not finish with our interview. So I'll have to jump straight to the next question, which so considering that diabetes is complicated and even difficult to manage for people with all the necessities. You might have all the necessities, but it still is difficult. The numbers are not adding up at times. People are depressed. So many things happen. So what are your concerns, especially for the patient who are skipping hospital or doctor's appointment?
Yeah, you see, it's very important for you to be monitored, because we are saying diabetes is a chronic problem. It's a chronic disease. You will need to manage it very well, again, so that you can prevent complications. And when you get that diagnosis of diabetes, the best thing to do is make sure that you're on top of those levels of glucose very early on, so that you prevent complications. So reviews are quite important, particularly when we are starting the journey of diagnosis of diabetes for the child and for the family. We really want to be able to see them for review quite regularly when we are starting off. We understand that there are fluctuations in terms of your glucose profile on a day-to-day basis, on an hour-to-hour basis, but we want to be able to help you to manage those fluctuations so that we avoid those fluctuations. We really want your glucose level to be in range most of your time, more than 70% of your time. We want it to be within normal ranges. So we really want to be able to review and to be able to make sure that our families are understanding how to take care of a child with diabetes, in terms of how to inject your insulin, in terms of how to take care of yourself, in terms of what to do when your sugar is low, what to do when it's high, what type of diet you're supposed to take, and to encourage exercise. So we really want those reviews to happen, and it's for the benefit of the child, it's for the benefit of the family to be able to grasp in a deeper understanding when we are starting off. You see, diabetes is not about the doctor. Diabetes is about the patient, about the child, about the family, and their day-to-day living. They need to be able to know how to do that, and they will only do that, they will only know that if we are walking the journey with them. And the journey involves a number of team players. It's the doctor, it's the nurse, it's the nurse educator, it's the dietitian, it's the pharmacist. So there's a lot that needs to happen, and that team needs to help you to get to the full understanding, where Tino today would probably know more about diabetes than I would do, because he's been living with it for so long. He actually knows that if I do this, this is what happens to my body. I need to do this. So we really want those reviews to happen.
And it is indeed that diabetes concerns everybody, your family, yourself, and the doctor is also concerned, because by him or her being your doctor, he or she would be concerned to tell you so that you can relate. If he says this, then you have to do ABC. ABC, so that things add up and then your management would improve, which is the end goal. I mean, which is great. Thank you so much for sharing this with us. This would help people to say they should have a different perspective when it comes to reviews. They should be taken very serious. Thank you so much, Doc. So allow me to move on to our third question. So a lot of people, or a lot has been said about diabetes cure around, especially in today's generation. So many people, the aspect of herbs, so many people say a lot, so many people have rationed, so many people have stopped taking their medications when they've been encouraged by the people in the streets to say you can stop. People that are not even medical doctors, and people are prescribed to use herbs. So I don't know, what would you advise to the audience who are maybe neglecting their medical prescribed medications for herbs, saying that they can cure their diabetes?
Okay, so we know that, when we talk about type 1 diabetes, there are lots of other subtypes of type 1 diabetes. We've got something called monogenic diabetes. We've got diabetes because of other things. So it's really important for you to be working very well with your nurse and your doctor. We would want a situation where we are discussing. When you feel that, no, I need this herb, we need to come and have a discussion. We need to be able to show you, look, this is how your glucose profile is looking like. And these are some of the complications. And you see, as we speak today, there is no known cure for type 1 diabetes. They need insulin. And the only thing that we need to do is replace the insulin. And unfortunately, it's still using injectables or pumps if you're in developed countries. So we need to be talking to our clients, talking to our families, because they should be able to talk to us, even if they feel that this is not the right medicine for me. We should be able to talk about it. We should be able to help each other. We know there are lots of studies and efforts to really try and screen for diabetes early, so that you can actually prevent early diagnosis of diabetes. There are lots of studies that are going on in terms of who you can identify, who you can target, who you can say, okay, I need to follow you more closely so that you don't get diabetes early. There are lots of studies on that. But in terms of cure, we have no cure as yet. But as I said, there are different types of diabetes, and they behave differently. So I think every person needs to be looking after their own health, talking to their health professionals, talking to them, talking to the team, talking to the counselor. And so that you can, when you've got fears, when you've got things are happening to you, we should be talking. And it shouldn't be a journey where you say, oh, I don't believe what they're saying, and then you just don't talk to us. We need to be talking to each other. Sometimes it actually helps when you're talking to your doctor and I say, okay, I understand that you feel that, this is not going to work, but listen, let's work together. Let me try and help you. And then we see, we keep talking. Even if there are complications and that happen, that door is still open. I think it's something that should be encouraged, where we are really talking to each other and we are helping each other as doctors, as nurses, and as clients.
I mean, this one would zero in on the fact that we do not have a cure. I mean, people should be, I don't know, maybe they should continue to be told this each and every day, to emphasize that you're not the only one who is being deceived. So many people come to you, people are after profits. So many people will try anything, you'll be deceived. They might say, yes, I had diabetes, but I'm cured. And then people will just believe it from that moment to say, oh, maybe because this person has said he or she was diabetic, and then they use this drug, then it helped them, which is not being deceived. Thank you so much. I mean, we have so many people have lost their lives because of this. They neglected even before they told their doctors. I mean, thank you so much for even telling to say, patients, let's come up together and let's discuss this and see how this thing works. But we do not have a cure. That's the thing. All right. Maybe, Doc, from your personal experience as a doctor, from all the patients that come to you, the people that you help each and every day, the people that you see each and every day, when I think you have also maybe even come up with your own ideas, or to say these are possibly the main factors that are leading to poor quality of life for people living with diabetes, regardless of the improvements in diabetes care. So what would you say are possibly the main factors that are leading to poor quality of life for people living with diabetes?
I think for me, the thing that comes tops is really the psychosocial aspects of diabetes. You see, it's really disheartening when every time a child is diagnosed with diabetes, and the first thing the community, the people say is that, no, children don't get diabetes. And that's misconception. Children get diabetes, and they get type 1 diabetes. So you see that sometimes when that statement comes, children can't get diabetes, it becomes quite a heavy toll for this child, for this family to accept the diagnosis of diabetes. And you see, different remedies, different treatments that are coming on board because of the fact that people believe that children don't get diabetes. And I think the first message out there should be, children get diabetes just like adults. And there are differences in terms of, the type of diabetes, and in terms of the differences, treatment that we need to consider. So that psychosocial aspect is really huge. that's something that's going to really determine whether you're going to do well or not. So for me, psychosocial aspects of the disease is one of the things that is going to lead to families getting psychological stress and not getting the help that they need. There's lack of information. People make poor food choices. They make poor choices in terms of who to trust and who to listen to. So there's lots of misinformation out there that really should be remedied. And also, I guess for diabetes, it's a chronic disease, like we said. So it plays a